Moments of Health and Wellness by Lady Stella Bryant of Antioch Missionary Baptist Church of Liberty City, under the leadership of her husband, Reverend Dr. Jimmy Bryant. Lady Bryant, it's all yours.
Good morning, Florida East Coast, the Southern and Northern Fellowship. To God be the glory. I've just had my 71st birthday. To God be the glory. Protocol has already been established. I'm Sister Estella King Bryant. I bring greetings from the Antioch Missionary Baptist Church of Liberty City, where the Reverend Dr. Jimmy L. Bryant is my pastor. I would like to take this moment to thank President Ramsey and President Scott for giving me this opportunity. I do want to be obedient to the time slot that has been given to me. So this morning, my Moments in Health and Wellness presentation is on the COVID-19 vaccine. I will attempt to answer frequently asked questions about the vaccine. Question number one, is the COVID-19 vaccine effective? The CDC and the FDA and all of the research so far has shown that 95% effectiveness with the COVID-19 vaccine, whereas with our flu vaccine, it is only 60% effective. One point I really want to make clear before I go further into my presentation is this. The COVID-19 vaccine does not prevent you from getting the COVID-19 virus. This is what happens. The vaccine works with your immune system so that your body is ready to fight the virus if you are exposed. The vaccine basically prepares your immune system. I want you to think about this in your mind. The vaccine puts your body in that fight mode. It basically, think about your immune system putting on boxing gloves. The vaccine trains your immune system how to react to the virus so that if you do encounter the virus, your immune system is there to get rid of it before you get sick. So, why should you get vaccinated? Two reasons. You should get vaccinated, number one, to protect yourself. Number two, to protect those around you. Why? Because not everyone can be vaccinated. Right now, including young babies and those who are seriously ill or have certain allergies. They depend on other people being vaccinated to protect them. Why is a COVID vaccine needed if we can do all these other things like wearing a mask over our face and our nose, washing our hands frequently, and staying social distance 6 feet away from everyone else to protect us from getting the disease? Right now, with all of the research, stopping this pandemic requires all the available resources. And as I said earlier, the vaccine works with your immune system. So other steps like covering your mouth, your nose, washing your hands, staying socially distant, all of those help reduce your chance of being exposed to the virus and giving it to others. Next question. Will you need to keep wearing the mask and avoid close contact with others if you have received both doses of the vaccine? The answer is yes. Right now, the experts is learning more and more about the protection from this vaccine every single day. So, and they need to learn more about the vaccine under real life conditions, because in the clinical trials, to be honest, they did not put sick individuals in the clinical trials. The clinical trials were only done on healthy individuals. So if you're thinking I'm diabetic, I have MS, I'm taking chemo, all of these things, what happened to those individuals when they got the vaccine? During the clinical trials, it was only healthy individuals that received the vaccine. So using all the tools available to help us stop this pandemic. And you will hear me sound like a broken record. Yes, keep wearing the mask, keep washing your hands, keep staying social distance 6 feet away from other people. Are there any side effects to the vaccine? Absolutely, yes. Like any medication, aspirin, the simplest medication you take, if you turn to the back of the bottle, of the vial, there will be side effects. So there are side effects to the vaccine. So far, the side effects have been minor, such as fatigue, headaches, muscle pain, chills, joint pain, and a sore arm where you receive the injection, or a low-grade fever. But the good news, most of these side effects go away in a couple of days. If you have taken the vaccine, number one or number two, and the side effects does not go away in a couple of days, you need to have a discussion with your doctor, call your doctor, let him know or her know what's going on. Now, I want to tell you that over 80% of the individuals who got the second injection did have side effects. But that's a good thing, because it's your body responding to the vaccine. That's fine. Again, if you get the second shot and it doesn't go away, you need to consult your physician. Are you immune to COVID-19 after you get the vaccine? That's a frequently asked question. Being a nurse, I have gotten several phone calls about that. You know, as a kid, when we had chicken pox, we were immune. We got the chicken pox. We never have chicken pox again. We may get shingles, but we don't get the chicken pox. That's what you refer to as a natural immunity. Once you come in contact with a disease, you build up a natural immunity. That's because, again, they don't know as much about COVID-19. The CDC is recommending that people not assume that you are completely immune to this infection after being vaccinated. So after you get your second dose, don't feel that you're out of the woods. Continue to wear your mask, continue to wash your hands, continue to stay social distance. Next question, who should not take the vaccine? The CDC, FDA, everyone is recommending anyone who has had an immediate allergic reaction to any of the ingredients in the vaccine, whether it's Pfizer or the Moderna. They are recommending that you have a consult with your doctor, talk to your doctor, but they're recommending that you do not take the vaccine. If you took the first one, you had allergic reaction, do not take the second. And again, this is a discussion that you need to have with your physician. That's the best person that knows your condition, knows your health, and Once you have that discussion with your doctor, the decision is still left up to you. Next question. Can I get COVID-19 from the vaccine? That's a frequently asked question, because the rumor was that the vaccine was the virus. All research shows no, you cannot get COVID-19 from the virus, because the COVID-19 vaccine does not use the live virus that causes COVID-19. Should I take the vaccine if I've already had COVID-19? We talked about that earlier. That natural immunity that you normally get when you have the disease. CDC, they do not know right now how long that natural immunity that you get from having the disease, they do not know how long it lasts, whether it's 2 months or 3 months. So they're recommending, even if you have had the COVID-19 vaccine, even if you have had COVID-19, you've had the disease, they're still recommending that you get the vaccine, because right now they're looking at a longer immunity with the vaccine than they are if you've had it and you have acquired a natural immunity. Next big question. Will the vaccine change my DNA? The answer is no. The vaccine uses something called the RNA. Your DNA resides in the nucleus of your cells, and the RNA is a one-way street out of the nucleus of the cell, and it's broken down very easily. So the vaccine does not change your DNA. Another frequently asked question, should pregnant women get vaccinated? Being pregnant places you in a very, very high risk category. This is another reason you would have this discussion with your doctor, and your doctor would recommend, if you're pregnant, whether you should get vaccinated. Can I get a COVID-19 vaccine at the same time as another vaccine? The question is no. You should wait at least 14 days between vaccines. So if you have had the COVID-19 vaccine, do not take the flu, do not take the shingles vaccine, any of those other vaccines, pneumonia vaccine, any of those. Give yourself 14 days apart. And usually they're asked that question, have you had another vaccine? So you should not take the vaccines within 14 days of each other. This was a question, the last question is the question that I had done a lot of research, came up with a lot of places where to get the vaccine. But prior to my presentation, you know, if you've been listening to the news, most of the places that were given appointments, they have canceled their appointments because of the delay in the vaccines to our state of Florida, most states. The individual places that was given the vaccine, they are now saving what they had to give the second dose to the people who received the first dose. So if you have been scheduled, just keep watching. The president has talked about getting those doses to us, and pretty soon I had done Mercy Hospital, Memorial Hospital, most of the hospitals and places that you could get a vaccine. But right now, when you go into the site, it says, appointments are being held off. Just on January the 21st, if you live in Broward, we have just now been added to the site online where you can go in and make an appointment. Prior to the 21st, we were not part of that system. We had places in Broward, but you could not go online and do it. So back to the basic overall about the effectiveness, 95% effective. about the COVID vaccine. If you have any questions, whether or not you should take the vaccine, talk to your physician. He knows your condition. There may be people who say, well, I don't have a doctor. There's places that you call, and when you schedule yourself for the vaccine, there are questions that they do ask you, screening questions. Again, if you have had an immediate reaction and to anything in either one of those, Pfizer or Moderna, you should not. The FDA, CDC is recommend that you do not take it if you have a reaction. Again, if you get the vaccine, both doses, continue to wear your mask, continue to wash your hands, continue to stay social distance from everyone else. I hope that this presentation have answered some of the frequently asked questions about the vaccine. If you have further questions, call your doctor, speak to your doctor, call them up if you don't even have an appointment, and ask, should I take the vaccine? Because he knows your condition better than anyone else. Anyone that lives in Broward, I do have that number. If you wanted to text me, I could get that number to Sister Scott, that they have started scheduling appointments in the system if you need to take the vaccine. But overall, we want to continue to protect ourselves and protect those around us. And the most important thing, everyone who have gotten the 2 doses, please do not let down your guard. Please do not feel that you are totally immune. If you want to ask anyone work in the hospital, has anyone come in who's had COVID twice? You would want to be careful. Do not assume that you've gotten 2 vaccinations and you are safe from this virus. Continue to wear your mask, continue to wash your hands frequently, stay 6 feet away from others, even with both vaccinations. This ends my presentation. I hope I was able to answer some of the questions that are in your mind about the vaccine.
Thank you so. Thank you so.
Sister Cooper. I'm sorry.
Just a second. We have questions, Sister Brian, and we like for you to entertain our questions. I think Sister Cooper was going to ask her question that's in the chat. Sister Cooper, you can unmute at this time and then ask Sister Bryant the question, please.
I'm sorry, I did come in a little bit late. When you take a COVID test and it is negative, how long do you wait to take a second COVID test for a negative result?
Sister Cooper. Sister Cooper, can
Yes.
you hear me?
Yes.
Okay. Is this a COVID test that you're taking and it was negative? Is there a reason to take it again?
Because some of the work sites require you to take to have 2 negative tests before you return.
Okay, because most of the jobs, different jobs is having different criteria as how long to wait to take it, right, with the incubation period, like 7 to 14 days. They usually tell you exactly how long in between that they want you to take it. Each job is different about how long to take it. Usually they'll tell you if you've taken the negative test, you've taken it, this is usually after you have been positive for COVID-19. You're positive for COVID-19,
right,
and then the job will tell you they need to see a negative. And then if they ask for a second, they usually tell you how long to wait in between.
Oh, okay.
Yes.
Okay,
But
thank
you're
you.
taking the second one only because you were positive for COVID and you need to take 2 negatives before you return.
Okay, thank you.
Sure.
Okay, are there any more questions? There are none in the chat. Does anyone else have a question for Lady Bryant?
Yes, I would like to ask Lady Bryant, what are some of the reactions that people have gotten from the shot? Do you know of any that have gotten a reaction?
Yes. You can hear me?
Yes, I can hear you.
Some of the reactions that individuals have gotten, they feel very fatigued after they get the vaccine. Some people get a low-grade temperature. Some of them get muscle pains, joint pains. And I know that the doctors have been recommending taking something like Tylenol or Advil, which is taking care of it. And like I said earlier, over 80 to 90% of the individuals who get the second dose has complained of sore arm, muscle pain, fatigue, but everyone is saying that that's a good sign. That means that your body is reacting to your immune system is reacting to the vaccine. So they're looking at that as a good sign. And it should go away in a couple of days. But if it doesn't go away in a couple of days, they are recommending that, you call your physician. But those are like known side effects of the vaccine.
Okay, what about, I was reading on there where it was saying about a rapid heartbeat. How long will that last if you get a rapid heartbeat from the virus? From the vaccine. Would it be right after you had the vaccine, or would it be a week or so after?
No, that usually occurs right after. Now, I don't know about most sites, but I was a little concerned when I saw people putting their arms out of the window and getting the vaccine, and I couldn't tell whether they were being pulled over to be monitored. The CDC recommends after you get it, whether it's that CVS, Walgreens, that you are monitored for like 15 minutes or so after you get the virus. So I would assume that if you're getting that virus and you're getting that rapid heartbeat, it would happen in that monitoring period, not after, days after you've gone home. But again, if that does happen, I would call my doctor immediately. Okay. And if it's or if it's very rapid and you don't know whether it's from the vaccine or not, I would get to the nearest emergency room or call 911. Rapid to me is like greater than 100.
Okay. Thank you.
Absolutely.
Yes, good morning. I have a question, Lady Bryant.
Yes.
I would like to know, speaking of rapid heartbeat, what if you have a heart murmur and you already suffer from heart palpitation? I know you probably would say ask your doctor, but what is your take on that?
If you have a heart murmur and got a rapid heartbeat?
Yes, along with hypertension.
Well, in the CDC, the research with the vaccine, that has not been reported like as a side effect of the vaccine. But
no, what I'm saying is that's already.
You're saying that if you have that condition, whether or not you should take the vaccine, right?
Correct.
Right. That again, you're absolutely right. I have been doing a lot of that. That's a conversation between the doctor, because once you're talking to someone, you don't know all of the inners of their medical condition, what else goes along with that, the condition. I would call my doctor, yes.
Because I've also heard something on the news that somehow it interferes with your hypertension meds You know, it's like 1,000 types of hypertension meds. You know, everybody's body is different.
Right. Correct.
Mm.
And that's why they are highly recommending everyone consult their doctor, go over their medical condition. And I am not advising you of anything that I did not do. I was actually late getting back on the 5:30 yesterday because I was trying to get from down south to my oncologist, who had done a slew of labs on me and was looking over everything. I just had that conversation with my doctor yesterday. I did not sign up for the vaccine until after my appointment, and we discussed everything. So that is a discussion to have with your doctor about that. Because at first, remember, we saw a lot of people, I think it was in New Zealand, another country, lady had a anaphylactic shock. We later found out she was a highly allergic and to a whole lot of things. And they're saying that anybody who is allergic, very allergic to most things, especially the ingredients in the vaccine, they're saying don't take it. And I know everybody's saying, how do you know you're allergic to the ingredients in the vaccine? That's a question that they normally ask you about, are you allergic to this? Are you allergic to that? And they know that that ingredient is in the vaccine. So that's when they will have that conversation with you. And I'm not sure when you're doing it over line that they're asking you that question.
Mm-hmm. So another question, you know, you got the Moderna, you got Pfizer, and then Johnson & Johnson's coming out with one. Are they all created equal? Because I saw on the news just this morning where this pharmacist is being arrested because he took some of the Moderna, I think it was 50 vaccine shots out of the refrigerator, and he's facing like 20 years in prison because he was saying that alter a person's DNA. What's your take on that?
I saw that. I saw what you're talking about. A lot of people had that fear at first that it alters your DNA. They were making like fun of it. But all of the research that I looked up, that they are using RNA, not DNA in the vaccine.
Well, all of them, I know you're not a doctor or pharmacist, but are all of the these companies, are they all created equal? Because you got different companies, you know, Pfizer, Moderna, Johnson & Johnson, you know.
Well, I wouldn't say that they're all created equally, but the CDC and the FDA, who does all the research on everything, they do a lot before they allow you to offer it to human beings after they do the clinical trials. I don't know much about the Johnson & Johnson. I know Johnson & Johnson is coming out with the vaccine that instead of having dose number 1 and dose number 2, they're giving 1 dose. So that is very new. I don't know much about the Johnson & Johnson. I did research on the Moderna and the Pfizer. Those are the two that I looked up with the, the effectiveness. And the Johnson & Johnson is very new. So I don't think the Johnson & Johnson has been released yet.
Okay.
Okay.
Yeah.
Okay. Well,
At this
and also
time,
I heard that. Can I just say
excuse
that
me?
Tyler Perry is having a special on just for info about the about that. You all heard about that, right? A special on BET Thursday night, and I'm finished.
A special on BET Thursday night about the vaccine?
Yes, I did, because he was on I think CBS this morning, and he was trying to. Did you all hear about that?
I did not, but I will look it up now.
Yeah, look it up. It's info, because I said I was gonna watch it. And I'm finished with the question. I just want to throw that out there as info.
Thank you so much for giving us that information on the upcoming BET event. Please remember to remute your line. And At this moment, I would like to just thank Lady Stella King Bryant